So if we can welcome Shahnaz. Thank you.
Hi everyone. So my name's Shahnaz Ashraf. I work for Focus Care in Manchester. I cover sort of the Longsight Ardwick area. I've been in Focus Care for a few years now. My background is speech and language therapy, and but we do come from various backgrounds working in Manchester. We sort of are based in the GP practices, and I always describe us as sort of sitting in between health and social care. So often patients' health's impacted by other things that are going on in the background. So they've got housing issues, as has been previously said, other things that are going on. And we will sort of pick up the patient and support them to basically do whatever we need to do to get them to a place where they can thrive and where they can function as a family. And that could be taking them to appointments, it could be supporting them with housing applications, supporting them with benefits, immigration issues, accessing food banks, accessing the community, anything that we need to do to try and support that family. So I'm just going to talk to you about one of the safeguarding cases that I worked on last year, and at what points we intervened, and the events as they occurred, and then the outcome. So the young lady that I'm going to talk about is a 20-year-old. They're a family of 2 adults, 3 children. She's 20 years old and is deaf, but no learning disability. So she communicates with sign. She accesses a local deaf club, and the family have come from Pakistan to Italy and then are now living in Manchester. So the younger 2 children are at school. So this young lady, there was a previous safeguarding around her where she'd reported to the deaf centre that her father had assaulted her, and she wasn't being allowed to come to the deaf club. And this was ultimately looked into, and she then retracted her story, and there was an investigation, but she decided to go back home because she wanted to be with the family. So about a year later, she came to see one of our GPs and was reporting financial abuse, that the family were taking her PIP money and it was being sent abroad. And again, the issues around her not accessing the deaf club that she wanted to. So the GP asked me to go and speak to the family and see if we could get a bit of background information to find out what was going on. We was reassured that everything's fine, she's misunderstood. She does have access to her money and things like this. We weren't wholly convinced, and we did raise a safeguarding and got a social worker involved. As this was going on, it came to light that the family were travelling to Pakistan. They were going to Pakistan very quickly within that week, which again raised alarm bells. We did meet with the family. The GP met with them and met with the patient on her own as well. And we were reassured that she was travelling to attend a cousin's wedding. Social services also had their own social worker who did the same thing, interviewed her with the help of a sign language interpreter, and we were reassured. She was happy to travel. She's got capacity. She wanted to go to a cousin's wedding, so at that point she was allowed to travel. A few days passed, and then she had my work mobile number because I'd been helping her previously. She messaged from there saying that she'd been locked away, they'd taken her phone off her, she was going to be forced to marry someone in Pakistan that she didn't want to go ahead with. So I spoke to my GP, the safeguarding person at Focus Care, and we decided to report it to the police and get social services involved again. The police went out, lots of reassurances from father saying that they're attending a wedding, there's nothing to worry about, but it didn't sit right. So I got in touch with the forced marriages people at the immigration, and they actually intervened very, very quickly. They got a named officer at the police, and things were set in motion that we managed to speak to the police abroad, and they went out to see, and again, we were told that no, she's fine. During this time, I received videos from this young girl to my work phone. She was clearly very distressed. She'd been hurt, and she was saying that she'd been locked away. They've taken my phone off me. she had bruises and things that she was showing on the videos, which then sort of we were able to give to the police that escalated it further. The family was still saying, no, everything's fine. They didn't know that we were in possession of these videos at that point, and we couldn't disclose that because she was still in Pakistan and it could cause an issue for her. What we didn't know is that after we'd actually spoken to father that day, he was actually flying out to Pakistan the next day. Didn't mention it at all. But immigration and the police had put a mark on his name at the airport. So as soon as they travelled, they were stopped at the airport and he was arrested. And then from that point, things sort of escalated quite quickly then. Again, we were still being given lots of reassurances that she's fine, everything's fine. And when we spoke to her on video, at this point the family weren't aware in Pakistan that we had videos. She was saying that she was being made to say that she's fine. We then had a court order issued against the father because he was still in the country. Now, I wasn't aware that we could do that. So the courts can actually issue an order to ask them to have her return to the UK within 7 days, that they no longer go on these where they go out and try and retrieve the person. It doesn't usually have a good outcome. So Dad was released and this order was placed for her to be returned to the UK. The 7 days passed and she wasn't returned. And then Dad was rearrested, at which point I think they realised that this is quite serious and she does need to come back. She did eventually, was returned to the UK and taken into local authority care where she was placed in temporary accommodation. Because there was a younger sister involved, she then also became subject to the same order for protection. And through, obviously as time went on, she was interviewed, she was seen by social services, she was seen by the police. She did ultimately decide to return back home. She does have capacity and there's lots of cultural issues around it where she didn't want to be isolated away from her family because of her communication needs. She was really struggling being in a hotel and being in an environment where she wasn't comfortable. And obviously the younger daughter had also been removed. So eventually she was allowed to go back home and through safeguarding meetings and all the agencies working together, we now have a court order in place for her that she can live at home, but she must have access to a phone, she must have access to her own money, and she's not allowed to be removed from the country. And this is in place sort of for the next 10 years or so, and after that it'll be reviewed at some point. So we did have a positive outcome. There was lots of agencies involved, there was lots of points where we weren't sure what was going to happen, but it was one of those where we had a really good outcome, and yeah, not always the case, but on this one it was.